If you've been dealing with persistent tingling, burning sensations, or numbness in your hands or feet, and you've tried the usual interventions without consistent relief, the botanical approach to nerve calming is worth understanding. Not because it fixes structural nerve damage. Nothing in a supplement can do that. But because there's a legitimate mechanism for reducing the nervous system hypersensitivity that makes mild neuropathic discomfort significantly worse than it needs to be. Peripheral nerve discomfort, the tingling, burning, and numbness that affects an estimated 20 million Americans over 40, has two distinct components. There's structural nerve damage, which develops from diabetes, B12 deficiency, or physical injury, and requires medical treatment. And there's nervous system hypersensitivity, the amplification of pain signals and reduced stress tolerance that makes those symptoms far more intense and persistent than the underlying damage would produce on its own. Many people who've had their neuropathy medically evaluated are dealing primarily with the second problem. And that's where botanical interventions have the most relevant mechanistic case. NerveCalm uses 4 botanical compounds targeting this nervous system hypersensitivity through complementary pathways simultaneously. Corydalis Yanhusuo is the pharmacologically most active ingredient. It contains L-tetrahydropalmitine, a compound studied at UC Irvine for its interaction with dopamine receptors involved in pain signal modulation. This is a different mechanism from conventional pain management, which targets opioid or COX-2 pathways. Corydalis works through a dopaminergic pathway that modulates how pain signals are transmitted and perceived without the dependency risk of opioid pathway interventions. California Poppy seed works through a GABAergic pathway, supporting the inhibitory neurotransmitter system that regulates nervous system excitability. When GABA activity is supported, the nervous system's overall amplification of sensory signals decreases. This is why California Poppy is also researched for sleep quality. The same calming mechanism that reduces pain amplification also reduces the hypervigilance that disrupts sleep in people with chronic nerve discomfort. Prickly Pear extract, from Opuntia fiacantha, provides antioxidant and anti-inflammatory support targeting the oxidative stress in nerve tissue that worsens both structural damage progression and local inflammatory pain amplification. Marshmallow Root, also known by its botanical name Althea officinalis, provides anti-inflammatory and tissue-soothing support that complements the other compounds, addressing the local tissue irritation component alongside the central nervous system calming effects. What NerveCalm can do? Reduce nervous system hypersensitivity, support GABAergic calming that may improve sleep quality alongside nerve comfort, and provide anti-inflammatory support that may reduce the amplification of mild neuropathic symptoms. These are mechanisms with legitimate botanical research context. What NerveCalm cannot do? Repair structurally damaged nerve fibers, reverse diabetic neuropathy caused by uncontrolled blood sugar, or replace B12 supplementation for deficiency-driven neuropathy. If your nerve symptoms are new, unexplained, progressive, or accompanied by weakness or coordination problems, get a medical evaluation first, before any supplement. Most users report the first noticeable changes at 2 to 4 weeks. Reduced intensity of tingling and improved sleep quality tend to be the earliest signals. Full benefit from the botanical anti-inflammatory mechanisms typically develops over 6 to 8 weeks of consistent use. NerveCalm comes with a 90-day money-back guarantee, which provides enough time to evaluate whether the botanical pathway approach is producing the expected response. Drug interaction note. Corydalis and California Poppy have documented potential interactions with sedatives, benzodiazepines, antidepressants, and blood pressure medications. If you take any prescription medications, review this with your physician before use. NerveCalm takes a coherent 4-pathway botanical approach to nerve discomfort, addressing dopamine-mediated pain signal modulation, GABAergic calming, antioxidant protection, and tissue inflammation support simultaneously. For adults with mild to moderate nerve hypersensitivity, realistic timeline expectations, and no significant medication interactions, the mechanism is credible. Full ingredient breakdown and where to find it safely are linked below.